The Ugandan government has introduced oxygen generators to replace oxygen cylinders in hospitals for emergency medical care, thus cutting costs. The oxygen generators capture air from the hospital environment, compresses it, and separates the gases in the air before supplying high purity medical oxygen to patients.
A health official at the Kawolo General Hospital in Lugazi, a facility that uses about 8 oxygen cylinders per week, Silvio Abiria, said the new technology, which was installed last month, has eased work. To discuss this further, we are now joined by Ugandan health journalist Henry Mugenyi. He joins us from Uganda. Good morning, Henry. Thanks for joining us.
Very good morning to everyone watching us right now, joining you from Uganda.
All right, so let's quickly get into why the government came up with this initiative. Is oxygen, still a huge need in Uganda?
Maybe just to take you through the hurdles we've been going through as a country, and in most especially in the last 2 years where we've had COVID-19 in the country has been lacking enough oxygen. And then this move where now government brings in generators to manufacture oxygen for us to get it at a very low cost, because an oxygen cylinder, an empty one, costs about 1.2 million, and then you have to refill it with oxygen again. Now that is quite a huge amount of money, and this is why people lost their lives. So many people lost their lives during the COVID-19 pandemic, because the country was really exposed to our capacity as a country in terms of providing healthcare service. But then this move, where we're going to be generating our oxygen, and it is already connected in different hospitals. For example, the Kawolo, the hospital administrators are already saying that the machine works well, but we cannot gauge how well it is working because it is still too early for us to determine how efficient this machine will be. But if more are installed in different health facilities around the country, this will help solve the problem that we are facing as a country.
Okay, Henry, you've talked about the fact that it's still too early to determine, the efficiency of this machine. Let's talk about the modalities. What does it take? What does it cost to set up these machines in the facilities?
Because it has only been set up in only 2 to 3 hospitals. For example, now the prices aren't yet into the public. We get to understand what exactly the cost implications are. For example, installing it in all the different hospitals. For example, one machine, how much does it cost? These are details we need to get from the Ministry of Health, that is the in-charge engineer at the ministry. We do believe by end of today we shall have these details, because I know, I've heard from them that they plan to roll this kind of initiative in all other different health facilities around. For example, when you go to Yumbe, when you go to Kawolo, when you go to Masaka, these oxygen generators must be installed everywhere for us to at least be independently oxygen supplied. Oxygen gives our cells the ability to break down the food nutrients, to get energy, but also survive. That is why we need this kind of oxygen. It is needed for a wide range of patients beyond beyond those that are suffering from COVID-19, but also other complications. Now, in the cost complications, we are yet to find out how much does it really cost when it comes to the local market, and then what does it cost on the international market.
Well, I mean, since of course the last 2 years, we've been just talking. We're talking mostly about COVID-19 and the pandemic, and so this definitely would ease the pain of hospitals and patients in those regions. But I want to get the response that this has gotten in Uganda from the hospitals and from patients. Is there any that you can share with us?
For example, the hospital administrator is spoken to. Besides the detail, the one at Kawolo, where Kawolo Hospital handled so many patients when it comes to emergency care, because it is a hospital that handles patients that are weak and that the family can happen around that is at so, for example, the hospital.
Seems that we're having challenges with the sound and the connection from Henry there, but The discussion really has been about, replacing, the oxygen tanks that were in place, or that were used rather, in the wake of the COVID-19 pandemic in 2020. And of course, the steps that Uganda and Ugandan government are taking to ensure that they replace them with, new ways of producing oxygen.
I think this is a genius move. I
Yeah,
really hope,
absolutely.
I mean, he said that it's just been there for a few weeks and it's not enough time to rate its efficiency. But I think this is a genius move, and I hope that, if it's effective in
Yeah.
Uganda, it's, brought to the rest of Africa.
Yeah.
Unfortunately, we're not able to wrap up now. We have to wrap up this conversation. We're not able to continue, but in another few weeks, we'd love to have you join us again. Thank you so much, Henry, for joining us this morning on the conversation. We look forward to having you again to give us feedback on how efficient these machines are.
Okay. All right.